we have so many case studies and stories that we could tell to tell to demonstrate how important it is as a therapy. And I would definitely advocate that it's like not having neuropsychology or not having speech therapy. It's just totally one of the MDT services that should be on offer.
Yeah, I think we've had many examples of patients that I've combined with music therapists, and we've really found great improvement. They've been a lot more engaging. It's helped improve their mood, especially in cases where we've looked at things like coordination and fine motor skills. It's been so useful, and especially when it's important to the patient, then they just become so much more engaged, and it definitely improves their outcomes. So I have a very standout one with music therapy, actually. So he was quite a young gentleman. Music was quite an integral part of his life as well, so very much a part of his identity. And our music therapist actually was involved in all disciplines, so not just with myself as OT, but also with physiotherapy and also speech therapy. And we found this gentleman started off where he wasn't able to speak, he wasn't able to walk, he wasn't able to use his hands. And in the end, through music therapy, we worked on different things with, for example, in speech therapy, they worked on voice work and breath work, and physio worked on his gait with coordination. He had ataxia, so we had amazing work in terms of his fine motor skills. And in the end, he was busy playing his guitar, he was able to walk out of the hospital and be able to talk. So really incredible story.
We always do half a joint session with our music therapist, and that's including training on balance. It could be seating balance, which is obviously we're looking at trunk strengthening, and obviously some upper limb work as well, which could be in dynamic sort of movement.
So I work with predominantly on fourth PDOC, people in prolonged source of consciousness, right across that spectrum from vegetative state to middle conscious to emerging. I work with spinal patients, I work with stroke patients, FND. From the perspective of sort of east and west, there is obviously sort of harmonic landscapes that are very difficult to recreate with Western sensibilities, but there are ways around it.
I think working with music therapy has been very enlightening, even for me as a speech therapist, as well as for patients. I think it brings out a side of a patient that we haven't seen before. It just changes their mood. They feel emotions much more deeply with the music therapists than in our sessions alone. And I think that's really great, because sometimes they've got their walls up and whatnot, and then a music therapist comes in and it's all like the patient, lots of times they start crying, or like they become extremely happy, or they giggle and stuff, and things you wouldn't have seen otherwise.
So I've seen a patient arriving in a VS that we call is a vegetative state, is a PDOC patient that is prolonged disorders of consciousness, and after a week or so into the intensive rehab unit, he emerged from this condition, and now it's been very responsive, so he gained consciousness, of the room, of the people surrounding him. So he's now answering to being able to make choices, So this is it's a very impressive result in a short time. Well, being able to introduce music into a hospital, a neuro rehab unit, I think this is very pleasing, and also to see the reaction, and of the patients, their families, and also the other therapists, being able to share these musical moments with everyone. This is so good.